Okay, in my practice, we try to maintain your teeth. That's the biggest goal, is we want to keep your own teeth. But sometimes, you have a crack in your tooth, or something's happened where you lost a tooth. It's imperative to get that tooth replaced. In the old days, all we had were bridges, which was basically crowning teeth on either side. But then you're creating it didn't work well with 3 teeth that you had. Now you have 2 teeth supporting what used to 3 teeth have. So we ended up, like, bridges would only last maybe 10, 20 years if you're lucky you get out of a bridge, and then you end up with a longer span bridge, and it's a cycle. So the great thing we have now is what we call the dental implant. And the dental implant is basically a titanium screw that takes the place of a tooth. The reason why this works so well is that it integrates into your bone. It's pretty inert. Your bone doesn't notice the difference between an implant or a tooth. So when the implant is in there, it just integrates in the bone, and it's permanent solution. So instead of having 2 teeth that are crowned, which you're weakening the tooth structure of your teeth. If you have 2 healthy teeth, we're not crowning those 2 teeth. We're going to put an implant in between there to maintain those teeth. Because if we didn't put an implant or a bridge, the teeth are going to shift. Then you end up changing your whole bite. Your bite collapses. That creates other problems. You end up with wear. You end up with headaches. There's a bunch of problems. People think, okay, I'm just missing, it's only 1 tooth. It's only a back tooth. Well, most of our chewing is done from the first molar forward. If you don't have those 3 teeth, those are critical teeth to miss. And the first molar is the first tooth to get in your mouth. It seems to be the most common, that if someone's going to lose a tooth, that's a tooth that they lose first. And then they say, well, I lost 1 tooth. They let that go, then another tooth goes. It's a snowball effect. And then you end up having to have partials or dentures or more extensive work, like many implants. So the best way to treat it is to get your teeth checked regularly, make sure that, okay, if you have a tooth that's missing, get it replaced as soon as possible. In my opinion, doing an implant is much better than doing partials or dentures or any of those other things, because with an implant, it restores your teeth to their natural function. If you have a partial is basically acrylic and metal. It sits in your mouth. It's something that's been around for hundreds of years, hasn't really changed a whole lot, and basically you're attaching to your other teeth, so it can weaken the other teeth you have. So I'm not a big fan of partials. The only reason you would ever do a partial is usually financial, or if you don't have even enough bone for implants. So that's the reason why when you do implants, when you lose a tooth, you want to get an implant soon, because we don't want to wait till you lose the bone, and then you can usually get an implant, but it may require extensive bone grafting, different procedures to get it done. But so the quicker you get it done is better. But if with a denture, that means you don't have any teeth up there. It's just all plastic. The only thing that holds it in on the upper is some of the suction. But if you try to bite in the front, it just pops out. The only way people keep them in is they hold their tongue in the back, and then they may be able to bite a little bit in the front. And over time, the only thing, you're losing bone, even with the partials or dentures. You're not gaining bone. So the fit of the partial, the best fit you'll get is when you first get it. Once you get the next partial, it's never going to fit as well. Same thing with the denture. But if you get an implant, you're maintaining the bone, you're maintaining the health of everything around it. So that's why it's much more beneficial to get an implant. When I started with dentistry, I tried to learn all the different procedures. I became really good at extracting wisdom teeth and different types of surgeries. When I got my implant training, I took some courses and just placed maybe like 50 implants, and then I wanted to learn more. So I went to a residency program where I learned how to place implants, doing more advanced bone grafting techniques. And we worked on live patients with a group of us. It was like 10 of us. And it was an amazing experience. I learned how to do all different types of implants, any different types of case. Well, if I didn't do it, I'd assist my partner. He would do a case and I would do the other. So we would at least get experience doing almost any type of implant case there was. We saw all these different complications that we're able to handle. And with that experience, I'm able to pretty much handle anything as far as with implants. I've also placed over 1,000 implants in my career. And what I've seen, like when I see cases come in, if an implant's failing, I have no problem taking it out, doing a bone graft, replacing the implants. A lot of times I see implants improperly placed, and then I have to go back in and fix them. It's much easier to do it right the first time. If you can get the implant in one shot and then without a problem, it's much more successful. Then you end up with less gum problems. There's so many reasons why you want someone who's done a lot of them.